The approximate number of GW undergraduates this year, 10,000. Out of those 10,000 little George Washingtonians living in Washington, D.C., only 5% don't have the skin color as Washingtonian as his. This means that there are only 500 Africans and African Americans on this campus, so when I had the chance to just survey 50, my results were interesting.
Out of the 50 students surveyed, 78% are currently insured.
A majority of African Americans struggle with maintaining their own health. 66% of those surveyed somewhat or strongly agreed with this statement.
White people generally have better health than African Americans. 79% of those surveyed somewhat or strongly agree with this statement.
Whites have an easier time achieving good health than African Americans. 87% of those surveyed somewhat or strongly agreed with this statement.
White people generally have an easier time maintaining good health than African Americans. 47% of those surveyed have somewhat or strongly agree with this statement.
During doctor visits, African Americans usually face biased diagnosis just because they're African American. 63% of those surveyed somewhat or strongly agreed with this statement.
I've heard that white patients perform better on routine physical exams than black patients. 43% of those surveyed somewhat or strongly agree with this statement. Doctors expect black patients to do worse on their routine physical checkups than white patients. 29% of those surveyed somewhat or strongly agree with this statement. 45% of those surveyed were neutral on this statement. Overall, the 2,535 participants of Harvard's online study, Project Implicit, many of those who reported having a medical degree showed a significant pro-white bias. This bias was significant among physicians of all racial groups except African Americans who were neutral.
Are we neutral because we don't know, or are we honestly scared of the truth? Either way, it's our job to find out. Don't be afraid to ask for help. There are many resources available, such as the AAHP, the African American Health Program, and there's also the U.S. Department of Health and Human Services Office of Minority Health. And there's also smaller resources, such as your local clinic or community center. Don't be afraid to ask questions, and spread the word if you know something.
Black Lives Matter.
Black lives are healthy.
It's yours.